The US healthcare system is very strong compared to a lot of other countries, but has its drawbacks that makes it rank last compared to 10 other high-income countries: Australia, Canada, France, Germany, the Netherlands, New Zealand, Sweden, Switzerland, the United Kingdom, and the United States, according to the Commonwealth Fund. This video will go into depth of the strengths and weaknesses of the healthcare system in the United States, as well as what we can do to improve it. According to world-class innovation, but at what cost? A brief examination of the American healthcare system by Spencer Delfino. The United States has some of the best trained physicians and medical technologies globally, but numerous reasons make them not as efficient as in other countries, nor effective. Additionally, the United States likes to continually advance its technologies, as cutting-edge technologies are one of the hallmarks of the American system. An example of this advanced technology is the technology that the Mayo Clinic has developed over the past few years. According to 10 pioneering studies from Mayo Clinic's Center for Individualized Medicine in 2024 by Susan Murphy, in a significant advancement for rare disease research, Mayo Clinic scientists developed a semi-automated system known as ReNew to rapidly reanalyze unresolved rare disease cases. While America has the potential to have a very strong healthcare system, it is unable to currently because of numerous limitations that lead to multiple inefficiencies in the system. For example, average life expectancy is very low compared to the other high-income countries. The numbers show that the United States is approximately around 77.5 years, while other countries tend to average around 82.2 years, which is a 4.7-year negative difference. Despite the average life expectancy being so low compared to other countries, the United States spends a much higher percentage of its GDP on healthcare compared to the other countries. In 2022, the United States used 18.3% of its GDP on healthcare than the 12% that the other high-income countries used. Additionally, the Affordable Care Act, ACA, which was implemented to help more United States citizens be covered by healthcare insurance and make it more affordable, still 26 million Americans remain uninsured. These uninsured citizens contribute to higher mortality rates due to having to skip medical tests, treatments, or medication. Citizens could be uninsured because of the high costs of healthcare. The ACA sets a maximum annual out-of-pocket limit of $9,450 for individuals and $18,900 for families. Despite this, 40% of Americans spend over $1,000 annually on out-of-pocket healthcare costs. It has also been noted that the healthcare system is very overburdened and expensive. A reason that could be the case is because many American citizens tend to go to emergency rooms for conditions that could be treated by a primary care physician. According to Emergency Department versus Primary Care Use, A Patient Perspective by Natasha Wu, USEDs see an estimated 144 million visits a year, totaling $76 billion, and 1 in 5 adults visit the ED at least once per year. Point 2. Many of these visits include non-urgent ailments that could easily be treated at the primary care office. Most importantly, unlike in other countries like New Zealand, primary care physicians in the United States are not well promoted or compensated for their extra hours, thus increasing patient reliance on emergency rooms. As a result, this increases patient stress and thus makes outcomes worse. So what can we do to improve these results? There are multiple ways we can do so, including increasing access to primary care services and incentivize their use, expanding Medicaid and private insurance subsidies to reduce the uninsured rate, simplify administrative processes to lower costs and reduce patient and doctor burdens, promote models that provide after hour primary care to prevent emergency room overuse, and lastly, address out of pocket expenses to ease the financial strain on patients. This structure will highlight the strengths, challenges, and actionable solutions for the U.S. healthcare system.